Hi, my name is Maureen Pickle, and I'm one of the clinical science liaisons and physician assistants with Microbiome Labs. We're presenting today Dr. Anna Cabeca, who has served over 10,000 women in her private practice and millions more through her books, online videos, and articles for over 20 years. With an understanding that modern medicine and time-tested natural remedies are not at odds, she is on a personal and professional mission to give proven pragmatic solutions to women dealing with menopausal health challenges so they can lead the life they want, need, and deserve. Happy to turn it over to you, Dr. Kavika.
Well, hello everyone. I'm Dr. Anna Cabeca. It's great to be here with you guys, and I'm excited to present one of my favorite topics on vaginal health and intimacy and the microbiome connection. So, just curious in the chat if you're able to message, how many of you saw my presentation in Monterey? Just put a Y if you saw my presentation in Monterey. I want to know how many new people I've got here listening. And then also, as I go through, if you have questions in the middle, I know we have time at the end for questions, but if there's questions that come up as you're like burning questions, top of the mind, go ahead and put them in the chat box, and that way we'll be able to, I may be able to stop and address them mid presentation. So good. A lot of new people to me. All right. A couple have been with me, have heard from me before. And so this is a pretty new topic. And then with this topic, are there areas of key interest to you regarding vaginal health and the microbiome? I'm curious, what are your patients dealing with? What problems are they experiencing? What questions do you have how you can help them better when it comes to vaginal health and the microbiome? One of the things I always say is vaginal health is necessary for optimal health, as is sexual health. Candida, recurrent yeast infections, bacterial vaginosis, definitely fertility issues. What about dryness? Yeah, menopausal dryness, BV, UTIs and BV. Great. And hello, Ruth. Severe vaginal dryness, fertility issues, recurrent herpes. This is a problem. I've seen cervical cancer, cervical dysplasia, abnormal pap smears, how to address that, vulvar pain, vaginal pH. And okay, great. And vaginal dysbiosis, herpes and menopause. Um, Odors, that's a big one. Lichen planus, lichen sclerosis, chronic vaginal discharge, our leukorrhea. Great. Okay, good. So I'm going to cover a lot of these topics in this presentation and give you some guidance, at least first next right steps to help support you, support your clients on this journey, yourself and your clients on this journey. So today's topic, vaginal health and intimacy and the microbiome connection. We'll be talking about um, understanding the importance of vulvovaginal health and the vaginal microbiome, and also be able to integrate options in therapeutic interventions, as well as discussing restorative vaginal as well as vulvovaginal treatment options, hormonal and non-hormonal. And key points are that to have a healthy vagina, you need a healthy gut. So you guys have a good foundation in that with microbiome. So I'm going to emphasize some points there, some nutritional fundamentals for sexual health, and that the sexual health is much more than about sex. And three key steps that you'll go home with to improve vaginal health. So first and foremost, the vagina is essential for life. It really is. We would not be here without contact one way or another through a vagina or with a vagina, etc. So this is a really important aspect. And currently in the mainstream, we hear a lot about vaginal estrogen therapies, and there's so much more to vaginal health, especially postmenopause, when we're thinking about dryness and discomfort and anorgasmia than estrogen. And it's usually one of the last things I do. So we'll talk about this. A key article that I read looking at women and their microbes, the unexpected friendship. This piece This research article, and I encourage you guys to read it. The authors in this research article say very clearly that, about the connection between vaginal health and general health from infancy onwards. And they say the origin of many diseases are hugely influenced by the health of the mother. And as friendly and unfriendly microbes clearly play a major role, it seems astounding that research funding from governments and non governmental granting agencies is alarmingly sparse and still far from being a priority. It is unacceptable that no breakthroughs have occurred in managing bladder and vaginal infections in over 40 years. And let me take an aside on the whole being floxed issues, Cipro and very common medications, the ofloxacins, et cetera. The concept of having neurologic issues after one of these drugs is extremely detrimental. I deal with that in my practice, some issues that clients have come in over the years with being floxed. So it's really unacceptable that we really haven't seen significant improvements. Furthermore, they continue, furthermore, the sole and unrelenting use of untargeted antimicrobial agents or unnecessary medical interventions for treating and managing these microbial related conditions suggests that the well being of women is not important. We counter that without reproductive health, there would be no humanity to make such decisions. And thus, we must start prioritizing the female microbiomes. Like the crowd goes crazy. I mean, this is like such an important statement. They further go on to say the human vagina is an underappreciated organ that is not merely a passageway for vaginal discharge, menses, sperm, and neonates, but can profoundly affect the health of generations. And it's like, I want to say amen every time I read this statement. It is so incredibly true. This is critically true. And when I trained at Emory University in Atlanta, Georgia, for my gynecology and obstetrics fellowship. And then I further did anti-aging and regenerative medicine training and integrative medicine. I continue to learn, right? And what we learned, okay, yeah, BV, give them Flagyl. And you may want to throw in a prescription for diflucan because they'll likely get a yeast infection after the antibiotic. And that's how we treated bacterial vaginosis. With no regard to the damage we were creating in these clients. The other thing is that clients with group B strep being given in pregnancy, given those antibiotics in pregnancy and intrapartum for treating group B strep without regard for rebuilding the vaginal microbiome, as well as changes that occur over time. So, yeah. So, and we've learned that again, the first seeding of our microbiome comes through the vaginal canal. So, what's happening in the case of C-section without labor? So, primary C-section, secondary C-sections, but without going into labor, so no contact with the vaginal flora. There's been, pros and cons, but more pros than cons with seeding, vaginal seeding, they call it, swabbing the vagina and applying the fluid on the nose and mouth of the infant. And the other thing, as an obstetrician, as I trained, we really tried to create a sterile vaginal environment in my training. You've got the surgical drapes up, you're swabbing the vagina and the vulvar area and perineum with betadine, and it's mistakes learned, but yet this is common practice today. So the importance of the vaginal microbiome is critical from birth, and our health started in our mother's womb. And without a doubt, that's critical. So a lot we can do. So let's first talk about what is a healthy vagina. When we think of a healthy vagina, the vagina is very acidic, right? It's very acidic. It is designed to kill those sperm. That's why there's billions of sperm for one egg. I mean, the vagina is designed with acidity to kill sperm, kill bacteria, kill parasites, fungi, etc., or invaders, viruses to prevent them from getting into the cervix and into the womb. So the healthy vaginal pH is 3.5 to 4.5, and it's either lower or higher, it significantly causes problems. And when we look at the vaginal flora, we really look at Lactobacillus crispatus as the key bacteria within the vagina. Also, Gasseri, Einers, and Jenseni. If I say any of them correctly, I would be very surprised. So, I mean, these are what dominate the vagina, but predominantly it is singularly Lactobacillus crispatus associated with health. In contrast to the gut microbiome, where diversity is king, we want high diversity in the gut microbiome associated with longevity, but low diversity in the vaginal microbiome. Additionally, a healthy vagina includes natural secretions, glandular secretions from the vulva, from sebaceous glands, sweat glands, Bartholin's glands, and Skene's glands, exfoliated cells, and cervical and endometrial cavity, as well as fallopian tube fluid. So, those are natural secretions from the vaginal tissue. And when we look at these trends in microbiology, we look at, in the case of a in the case of bacteria invading the vagina, that it creates a breakdown to the wall of the vagina in case of adverse bacteria or higher diverse bacteria within the vaginal microbiome, creates increased macrophages, increased immune response, etc., to the vaginal wall, creating a degradation of that good mucous membrane within the vaginal wall. There are hormonal changes that occur peri and post menopause. And this is associated with the declining hormone levels of estrogen, progesterone, testosterone, and DHEA. Note, I don't just say estrogen. Really important here. And, progesterone being one of the mother hormones, and testosterone converts to estrogen, DHEA converts to testosterone. They also, because of these declining hormonal levels, we see an atrophic epithelium and decreased musculature, as well as an increase in alkaline pH of the vagina. So it gets above a 4.5 into 7, 8, and makes them more susceptible to that bacterial vaginosis and other infections. A decline in the glycogen levels and a decreased normal healthy flora with increased diversity. And vaginal dryness is critically important to address. Every woman will experience it unless we're actively intervening as they're, actively intervening with, again, pelvic floor exercises, vibration, sex in general, and hormones and vaginal probiotics or probiotics that are targeted for the vagina, which is critically important because, if you go down a water slide while it isn't wet, you'll understand why foreplay is so important. So it takes time as we get older to increase the natural fluid secretions, but it's important that we do it. This is a good visual of a healthy vagina versus a more aged vagina. Not just the ovaries shrink, but the musculature decreases, the vasculature decreases, the nerves decrease within the vaginal walls. And so you go from this, incredibly, like I would say, voluptuous vaginal tissue that's able to expand to allow a fetus to pass through, to a very more narrow canal with decreased elasticity and decreased moisture, which is more susceptible to microabrasions like in perimenopause, tampon trauma, trauma during sex, microabrasions during sex, tearing, and infections, and really in the long haul, increased susceptibility to other pathologies, herpes, HPV, and cancer. So this is, even though it's a normal part of aging, it does, do not ever turn a blind eye to it. I know I'm speaking to the choir here. That's why you're on this call. So here's another example of what's happening to the vaginal microbiome over a woman's lifespan. And so we can see pre-puberty, there's diversity within the vaginal wall, a thinner epithelium, but then with reproductive hormones, post-puberty and premenopause, with reproductive hormones, we get a thickening of the epithelium, very good elasticity in cells and a more uniform vaginal bacterial constitution, so less diversity. And so you'll see a high glycogen level, so good nutrition to the vagina to feed these healthy bacteria, and a low vaginal pH. And that's so important. Now, postmenopausally, we get again a shrinkage of these issues, thinning of the tissue, lost in elasticity and blood flow, and increased diversity. You look at this picture and I'm like, ugh, I just don't want that to happen, right? I just don't want that. There's way too many bugs having a party in my vagina. I'm not going to allow it, right? So you want to make sure like we're addressing these issues because it puts us at increased risk for diseases, HPV and cancer specifically. So what is going like when we look inside the species within the vaginal microbiome? I mentioned that predominantly it is lactobacillus, and key is the lactobacillus crispatus. And these help regulate the vaginal pH. They kill and inhibit bacterial growth and support a healthy vaginal microflora. These organisms stick to the vaginal surfaces, prevent non-beneficial organisms from growing, such as, again, that's what decreases that huge diversity pre-menopause because of this key protective effect. However, that is, destroyed with antibiotics. And if you consider that if you're not eating organic, free range, non-antibiotic treated, whatever, that if you're eating chicken out, steak out, fish out of your own house and it's not organic, free range, or wild caught, you're getting a dose of antibiotics every time you eat. So not just affecting the gut, but affecting the vagina and the quality of a woman's health for her lifetime. So, so that's really important to remember. Lactobacillus also inhibit the binding of other bacteria to the vaginal epithelial cells and to keep it healthy. And lactobacillus species has been scientifically shown to reduce the risk of UTIs and vaginal discomfort. So I wanted to show this slide because when I came back I had retired from practice for several years. And so pre-pandemic, I retired. Post-pandemic, I came back into practice. I'm here in Dallas and I started back in July of 2023. One of my first clients is a woman I'd known for a few years who's 72 years old and, beautifully fit, worked out at the gym every day, very health conscious, ate really well, and very sexually active. Well, and she was put on hormone therapy at a local clinic. And during that time, she started spotting. And so, so it was like January or February of 2023. So before I started practice, she's like, Dr. Ann, I'm spotting. My doctor says that this is probably because they adjust my hormones, and she was on testosterone pellets and estrogen pellets, and I was like, I never like estrogen pellets in women with a uterus, so let's see what you can do to convert and make sure you're up to date on all your screenings. And so she went back. So her doctor, over the phone, telemedicine, did adjusted her hormones, and she still continued to have bleeding and spotting. So and I didn't hear back from her until April. And she goes, I'm still having spotting again. I said, well, what was your pap smear? What did your ultrasound say? And she said, well, they haven't done a pap smear since I went into menopause in my 50s. And I was like, oh shit. Like, okay, anyone under hormone management, anyone with a vagina needs a pap smear till we die. I mean, this is in that concept that we don't need it any longer. I mean, you can decrease the interval of screening, but you need an exam. And she hadn't even had a pelvic exam, didn't need them anymore because she was postmenopausal. I hate to say that this concept is existent within our medical culture even today. And so this was, by the time she got her pap smear and she was going for an endometrial biopsy, and she did an ultrasound. She had stage 4 cervical cancer. So she was my first patient in clinic when I came back in to start doing integrative therapies, vaginal ozone, IV, a variety of IV integrative antineoplastic therapies, and in addition to her cancer course at 72. And her oncologist, as I consulted with her oncologist to let them know what, to make sure what I'm doing with her, he approved. He goes, basically she's stage 4. The prognosis isn't good. I doubt she'll make it 3 to 4 months. It was really, cervical cancer is nasty. She wasn't a candidate for rods and cones, wasn't a candidate for pelvic exoneration, which is a significant surgery that we do. And, it just boiled my blood. And this client, this friend, and now patient of mine, we really started with this integrative therapy in addition to the chemotherapy and the oncologic process she'd been on. But it's just a tragic situation. Well, I will tell you, she's still alive today. She still has stage 4 cervical cancer, but she's driving, she's getting out, she has friends, but she's definitely weakening. So she's certainly outlived her life expectancy, but this was a completely preventative disease. This was completely preventative. And if it doesn't make your blood boil like it does mine, I would question that, but I'm sure it does. That is so much to this. So what happened? What created her susceptibility to cervical cancer? Yes, she was vaccinated just one time, but still she was vaccinated. So we've seen turbo cancers. And also, again, while she was doing hormonal therapy, no one examined her vagina or the microbiome of her vagina. And this is where microbiome labs come in with their new test, the vaginal FX. And I think that's an important test to look at because you want less diversity, good lactobacillus. And if we know we can do that to support the entire vaginal health, that's key. The other thing is I use topical hormone therapy. One product I created, Julva, that's over the counter and able to get that helps with increasing your body's natural mucus and regeneration of cells too, and the vaginal mucosa. So the combination works really good with a vaginal probiotic or a probiotic to help reseed the vagina to have healthy lactobacillus species. So what's happening with HPV? Now we know HPV is carried by most of the population, and immune system really takes care of the majority of HPV. But with lower lactobacillus populations and higher microbial vaginal diversity, other species, we see a higher pH and we see an increase in dysplasia and cervical cancer. So, well, wouldn't it make sense to be a primary therapy to not just check to see if they have high risk HPV and do I'm guilty of this. I'm a classically trained gynecologist, but had to learn all this post residency. But we're told, okay, we'll just do a LEAP procedure and come back in a few come back in a few months and we'll repeat the pap smear, put you on this frequent pap smear schedule, especially if you have high positive HPV positive. But the concept was never, okay, let's regenerate a healthy vaginal mucosa. And what can we do to do that? And what integrative therapies do we have to counteract a positive HPV and a increased vaginal microbial diversity? So what we can do now, and I'm going to integrate this with some implementation I'll share with you now. Like when I have a client with positive HPV, first and foremost, I put them on a product that has sulforaphane glucosinate in it, SGS. And I use SGS, I use the Oncoplex ES. That's just the one but there are many brands. Oncoplex, I use vaginal probiotic, Lactobacillus crispatus, like microbiomes. I'm excited to be using that now. And I would use it vaginal probiotic as well as oral probiotics and hormone, to help support. So in the client who is still premenopausal, I won't initiate hormones, but I will do probiotic. I will do the Oncoplex, and I will do a methylated folate, typically 1 milligram of methylated folate with the Oncoplex ES. And I'll and we'll see a reversal of this in HPV, high risk and low risk HPV, so condyloma. And they figured this out way back in 2003 when I had a young 23-year-old patient who came into my clinic in Georgia. And she was a college student and struggling financially, but she goes, Dr. Ann, I've got a lesions. And so I examined her, and my nurse and I examined her in my office, in my exam room, and she had the worst case of vulvovaginal condyloma that I have ever seen to date. Now, in my 30 years, hers was the worst case. It looked like broccoli and cauliflower. I'm telling you, okay, that will make you cringe. And sorry to be graphic, but you guys, it's just the truth. So I was like, I can't even laser this. There's no way, can't use trichloroacetic acid, which would be a treatment for condyloma externally and also within the vagina. I can't do laser. It is way too advanced. Or I can, but I'm going to have to do it in the OR. There's no way I can do procedures or excisions of this magnitude in my office. I said, I was reading this research article on this SGS from research out of Johns Hopkins that said it could be beneficial for viruses, HPV specifically. Let's try it. And so I put her on the Oncoplex, and I put her on the methylated folate and at high doses. So I had her take twice a day of the Oncoplex and 1 milligram of the methylated folate daily. And I said, come back in 6 weeks, and I'll pre-op you for surgery. But, this is the best we can do. And she said, she was willing. And she came back in 6 weeks later, and I examined her, and there was no condyloma, none. And my nurse is there. I'm like, Rosanna, look at this, and she's like, yeah, because, we use the vinegar to whiten. When you have condyloma, you use diluted acetic acid to whiten the condyloma, and it lights up. And there was nothing, not vaginally, not externally. I'm using my colposcope. I'm like, what's going on here? I said, what did you do? She goes, Dr. Anna, I did what you told me to do. I'm like, oh, how nice, how amazing. And I followed her up again in 6 months, negative PAP, no condyloma, no issues, right? And so I started using it in my clients with abnormal pap smears. And okay, I said, you got an abnormal pap smear. Let's start on this regimen. And then I'll bring you, like a low grade dysplasia or high grade dysplasia, schedule you for your LEAP procedure in a month. And that's, when they have a need to do an excision of this dysplasia, they'd come back in, and I look with a colposcope, and there's nothing there. So I biopsy, nothing there. And the high grade lesion, I shallow LEAP, came back negative time and time again. And, let me say that's God working, because that is, and I still do this today in patients with HPV or dysplasias or abnormal pap smears. I still do this procedure today, and it consistently works. And I'll have clients come in and say, if they had, vulvar warts or vaginal warts, she goes, they've just been falling off. And I'm like, okay, that's really gross. I'm not, derm is like, definitely avoid derm, but it is, it's truth. It's what happens. So you can see the clinical utilization. And now I also use the lactobacillus. I empower them with using vaginal probiotic and oral probiotic, as well as if they're perimenopausal I use topical DHEA, like in my Julva formula, and or vaginal suppositories to replenish good vaginal hormone. DHEA and testosterone works 10 times better in the vagina than estrogen. And it's safe if you have a male partner and sexually active. So estrogen is not. So when we consider that, there's so much we can do here. When we look at this profile, what we see is in general, the lactobacillus in this graph is in the premenopause or HPV negative, healthy levels of lactobacillus. In the and HPV positive, we can still see healthy levels of the lactobacillus species, but we see a significantly less amino acids, so nutrients and glycogen-based nutrients within the vagina. And HPV starts to create, it's kind of like zonulin. It's putting the foot in the door of healthy membranes. So essentially kicking down good, healthy boundaries. And HPV, high-risk HPV, does that. So we get seeding and an increase in histological changes within the cervix. In low grade, we have abnormal cells, high grade, significantly more abnormal cells, all the way down to the epithelium. And then in cancer, of course, more metastatic cells and a lower vaginal pH and significant non-lactobacillus species. So there's a lot we can do to reverse these changes as long as we catch it soon enough, right? As long as we catch it soon enough. So, yeah.
Dr.
We-
Cabeca,
yeah.
I am sure we could spend a whole webinar talking about HPV, but some folks have asked if you have a specific protocol for timing of how long you use these supplements and
Oh, yeah.
probiotics for HPV.
Yeah. So it's a great question. So again, it depends on the individual and their vaginal microbiome. But typically, I would say, like in a reproductive age, healthy reproductive hormones, you can do a course of typically 3 months. And you can start, typically, I'll start 3 times a week with a vaginal probiotic, oral probiotic daily, 3 times a week vaginally. Eliminate sugar, eliminate, if they're on the birth control pill, choose a different form of birth control. And the Oncoplex and um, the methylated folate I would use for at least 6 months, at least 6 months. And then I reduce the dose. After that, I'll do a maintenance dose after a negative follow-up. So for HPV, does that answer the question? And in some clients, I have clients who, post hysterectomy has had vaginal dysplasia, and she's just on daily. I mean, she's just on daily maintenance to effectively, hopefully, boost, reduce that, as well as everything else we do from a functional medicine perspective to support the immune system. So, yeah, so that, sometimes it's a part of their foundational supplementation that'll keep them on this. Okay, great question. Any other specific questions? Why methylated folate? Um, that's what was published in the literature for antiviral. And this is again 20 years ago, but that's consistently worked. So I use the methylated folate. So I have no experience with it or success using folinic acid or folate. Okay. All right. Um, Mareen, any other questions? Let's see here.
We're getting a question about, can you talk about the prevention of UTIs?
Okay. Okay. Yeah. Then I'll get into that too at the end. All right. Okay. Let's see here. Yeah, and I'll come back to any questions that I've missed. Um, okay. All right. So some of the hormonal changes that we age. Well, first of all, okay, let me see, how are we on time? We've got about 10 more minutes. Then I'll go into questions. But first of all, just understanding the hormonal changes as we age, that we start to lose DHEA first, then progesterone, then testosterone and estrogen. So, and we'll see high fluctuating levels of estrogen. And this is this estrogen dominance phase that can put us at risk for things like endometrial cancer, cervical dysplasia, among other things. All right. So I want to talk a little bit about hormones and the impact on the vaginal microbe. So estrogen therapy increases lactobacillus species and decreases the vaginal pH, which is what we want, and increases vaginal maturity index. In postmenopausal women, it has a greater impact on the vaginal microbiota and the metabolome and pH compared to non-hormonal therapies. Reduced estrogen levels during menopause increase vaginal pH and decrease lactobacillus, as well as higher estradiol levels increase lactobacillus and decrease microbial diversity, which is what we want. Progesterone, and I would say, like this is key for estrogen. DHEA converts to testosterone and estrogen at the intrinsic cellular level. So I found DHEA works even better, but you can use both, absolutely. Progesterone's impact. Progesterone also influences the vaginal microbiome composition and abundance. It facilitates glycogen release and aids to achieve that normal acidic vaginal pH. High progesterone during pregnancy reduces microbial diversity. So we get that predominant lactobacillus, that healthy vaginal um, uh, bacteria. And progestin only contraceptives alters the microbiome in a negative way. Menstrual cycle fluctuations also impact the vaginal microbiome. So if you're doing, if you're doing vaginal microbiome testing, you want to document when in the menstrual cycle in a menstruating woman you're doing that also, so that you can compare the next time you do the follow-up, proof of cure of the vaginal microbiome, you're doing it at the same time of the cycle for consistency. Sometimes we don't think about that, but consistency in testing helps you with your plans and therapeutic interventions. DHEA effects on the vaginal microbiome. So when we use DHEA vaginal suppositories, results have shown parabasal cells decreased by 27.7%. The superficial cells increased by 8.44%. So that's good epithelial cells. When we look at I don't know how many of you have looked at wet smears. Again, we used to do that. Now we just send off vaginal fluid to the lab. But I was trained to look at the vaginal fluid under the microscope and see, is there a lot of bacteria? What's going on with the epithelial cells? Do they look anucleotic, atrophic? What's parabasal? And that shows atrophy and dysfunction as well. So we don't do that anymore. So we're relying on the labs to we rarely do that anymore. We're relying on the labs to give us those results. Checking vaginal pH is another easy thing to do with just pH paper. And you want to look at that. But we've seen with DHEA vaginal suppositories, we get a decrease in vaginal pH. We have pain with sexual activity is decreased, and vaginal dryness severity score is improved. Oxytocin is something that can improve the vaginal microbiome. In working with sexual health and orgasm in patients, often I'll use oxytocin vaginal gel. This I typically will use 50 IU in a rapid dissolve tablet to be easy to insert into the vagina. And this study looked at with 400 IUs, which is a significant dose. I never feel like I need to go up past 50 or 100 IUs. But after 8 weeks, the vaginal pH decreased significantly compared to placebo, and vaginal cell maturation index, or VMI, improved significantly, as well as subjective symptoms of vaginal atrophy improved. So, and then I want to address the UTI. So I'm not going to may pause here a second. I want to address the UTI issue and what's happening with urinary tract infections, as this is a really big issue as we patients are coming in with increased urinary tract infections. So there's one thing associated with age. With perimenopause, postmenopausal urinary tract infections can result from the hormonal decline. So with atrophy, I showed you that diagram of healthy vagina versus unhealthy vagina versus aged vagina. We show you that the lining thins out. The same things happen to the urethra, and I wish I had a picture to show you. But you get the decrease in the elasticity, the decrease in the musculature, increases in incontinence, and increase because of that decrease in that. I mean, it's mechanical. Part of it is mechanical. So with that decrease in elasticity, you're allowing more bacteria into the bladder. So with sex, post intercourse, urinary tract infections, very common complaint that can be completely avoided. So I'll give you an example of a client, Nancy, who was 56 years old. She'd been divorced 20 years, got her kids off to college, and then started dating, met the love of her life. And she goes, oh my God, this is amazing. She goes, but she called me. She goes, Dr. Anna, I'm on my third urinary tract infection. And my doctor, she was out in California, my doctor wants to put me on daily antibiotic, macrobid 100 milligrams per day. And she said, I need to do this. And she goes, I know enough from what you talk about to think that might not be a good idea. I'm like, oh, thank God you called me. Okay, Nancy, let's try this. Don't take the antibiotic. First of all, increase your vitamin C to 2,000 to 4, to take 2,000 to 4,000 IUs per day. Start a probiotic, and I put her on a predominant lactobacillus probiotic as well. Um, and you start using Julva every day and with intercourse, and then pee after you have sex. She had complete repair, never had another urinary tract infection, and happy to say they've celebrated their first year anniversary. So, because intimacy is such a key part, and when you have any negative feedback to that intimacy, it draws you apart. You less desire. If you have discomfort every time you do something, or urinary tract infection every time you do something, you're going to want to do that thing less and less. And that's where intimacy can, you can get a block in intimacy too. So that's an easy UTI regimen. That's a very easy UTI prophylactic regimen, and especially in people that have had, that have had even one UTI is abnormal. Okay. So even one UTI is abnormal. So we want to prevent them from getting a second UTI and heal that tissue, reverse age that tissue. And that can make a really big difference. The other thing in this instance is the thing that I advocate a lot, if you followed my platform, is something checking, emphasizing alkaline urine pH. So just think of this for a second. If we're thinking, okay, I'm very acidic, and it could be from diet, nutrition, stress, other infection, inflammation, etc. But if you're constantly having an acidic urinary pH, because hydrogen ions secrete across the renal tubules, and in time of stress, that's creating this very acidic bladder pH. Over time, acid in a vessel of any kind is going to eat away that vessel. So we see more infections, more interstitial cystitis, more incontinence issues, urinary frequency, etc. So checking that urine pH and getting that alkaline is a key part to healing, not just the bladder, but your entire physiology. And I haven't heard anyone else talk about this, but it just makes sense. You've got acid in a vessel, right? In organic matter. I've had clients come in with pHs of 5. That was mine in perimenopause. How I figured this stuff out. I'm like, kind of peeing acid. That is not good for my body, right? And so you switch that around, and urinary frequency goes away, urinary tract infections go away. You're improving in general, your health by improving your physiology. And that is, electron transport across the cell membrane. This is an indication of how healthy are you doing it. So urine pH is a biomarker that I say is as important as your pulse, your weight, your blood pressure, etc. So checking that urine pH is key. All right, I want to make sure to answer some questions here.
We have a good one that says the vagina and the gut are having a bidirectional communication, and the participants curious about the implications on focusing on the gut over the vaginal microbiome. Are you seeing it better to focus on both at the same time, or does one have more influence than the other?
In my experience, you've got to address both. You have to address both, because you can get the probiotic internally and into the gut, etc. But for that to translate to the vaginal seeding of the probiotic, you really have to get the glycogen levels up, the pH down, so that you have that decreased diversity to support that predominant lactobacillus species. So I find oral and vaginal to go hand in hand. Yeah, great question. All right. Um, okay. So
We also have a question on fungal overgrowth after intercourse. I'm not sure if someone can
can you
clarify
expand
what
on
their
that?
question is.
Yeah, expand on that question. So, okay, so, if you can, are you getting yeast infections after intercourse? Are you using a spermicide, a lubricant, um, condoms? What's happening with that? Um,
Someone's asking a question around lichen planus.
okay. So for lichen planus, same thing. But I find that using topical DHEA is really critical to help restoring the healthy epithelium the healthy skin. So I use hormones for that, definitely. Also look at the reason for the lichen's planus, right? Anything that's happening on the skin is a reflection of what's happening on the gut, in the gut. So looking at, addressing gut issues, food sensitivities, eliminating those, and decreasing candida throughout the system is key. Also, what are we using? What are we using? Pads that are non-organic, underwear that, microplastics. The vulvovaginal area is very vascular. It's why it's great. I use a lot of hormones in the vulvovaginal area because it's so well absorbed. Well, that is true for toxins too. So detox in addressing lichen planus is good. Testosterone, and acutely you can use clobetasol, but again, it's not an answer. But acutely, you can use clobetasol and LDN. So topical LDN I'll often use, or oral LDN. I see this question from Connie. She says, I'm 14 years post-menopause, not on any hormones. I find that using a dildo every few days has made a very big difference in not having UTIs or leaking. I also have no vaginal pain. And I think this is so important. Like, again, the vagina is full of muscles, right? We have a ton of muscles within the pelvic floor. So exercising them, doing your pelvic floor exercises, contracting. There are specific vibrators with red light therapy that work really well. Fringe is one, and Joylux is another that I'll recommend for patients to use too. Using a jade egg intravaginally, or Lilo ball, Kegel ball intravaginally to help the muscles contract. And also, of course, using a vibrator or having sex and exercising those muscles makes a big difference too. Okay. See.
Someone's asking for clarification for someone that's postmenopausal and getting recurrent UTIs without being sexually active. I think you spoke on this a little bit earlier, but maybe we could.
Yeah, I would definitely do
Go.
the same regimen. I would do Julva topically and end with maybe some vaginal hormone, DHEA and testosterone. You can use Julva intravaginally as well. So that will give you some DHEA. It has plant stem cells and emollients to really drive the ingredients deeply into the tissue. And a probiotic, taking a good lactobacillus probiotic daily, focus on that urine pH, get that alkaline. And vitamin C, 2,000 to 4,000 units a day. And let's see how you do with that, and make sure you're hydrating well. Um, yeah.
Would
And
your
avoid
advice,
any perfumes, any fragrances, you know, use clean organic underwear, all that good stuff. Cotton
Connie
underwear.
S., would your advice on lichen planus be the same for lichen sclerosis?
It's pretty similar for lichen sclerosis. With lichen sclerosis, what I found, and it is a challenge. It is definitely a challenge. So always I use topical hormones, DHEA and testosterone for lichen sclerosis. I work on healing the gut, food sensitivities, and autoimmune paleo type diet, and LDN in these clients. And I have a client right now in full remission from lichen sclerosis, but it's taken us a good 8 months. It's taken us a good 8 months to get here. So,
Uh,
okay.
we've had a couple of questions regarding inserting the vaginal balance probiotic intravaginally.
I think that's great. I think that's great. You would definitely, like one for the vagina, one for the mouth, right? Like that is, it's a great product. Um, and the issue is as we get more atrophic, the capsule will not dissolve as fast. So it may take a while for that capsule to dissolve. So you can break it open. Um, any oil you put on it will help dissolve the capsule. So that can help speed up degradation of the capsule. Otherwise, you can put some into, um, sometimes you can use, clients do different things, but like a yogurt or non-dairy yogurt, add that in and do a vaginal flush with it. I typically will say that you can do like water in a container for douching, and just put a little bit of water in there and lay down, just a little bit of water, enough to empty the capsule into that little bit of water, and lay down, insert that vaginally. You can do it that way, as no doubt you're getting it. But typically the capsule will dissolve within the course of a day. Typically, it will dissolve within the course of a day. So I think that's absolutely fine to use. I mean, it's absolutely great to use vaginally, but I think it's absolutely fine to insert it with the capsule. But you have to see, if it's not dissolving, then you need to just put it in a little bit of water and flush it. And I don't know, Maureen, any other suggestions for that?
We've had some providers that have given us feedback where they've advised their patients to make their own suppository with vaginal balance and oleic acid, which is found in organic olive oil.
Mm.
And it's seems to be that, they've reported that they've had some success. So even though Microbiome Labs vaginal balance product was designed to be taken orally with the thought that there's translocation from the gut microbiome to the vaginal microbiome, we have had providers that have reported being able to use it that way. We also have
And
questions.
that's another thing too. I mean, you can soften the capsule. It's a mess, right? I'm a woman, right? Like I've been, dealing with vaginal stuff a long time, but it's like, it can be a mess to create that too. But you can also soak the capsule in a little bit of water to start dissolving the capsule, or a little bit of oil to start dissolving the capsule, and then insert it vaginally. So it is a two-step process, but you can see. Yeah.
I
I,
saw
I'd love for you to create, I'd love to get, more more experience, more other physician experiences on using it vaginally too, to dissolve it. So, but that's what we've done in the past with capsules.
we have an important question regarding a recommended lubricant during sex or when using a vibrator, and I think this question comes up often from providers and patients.
Okay, say the question again.
If you have a recommended lubricant that you recommend for your patients.
Oh my gosh, it's almost like I paid you to say this. I have a lubricant coming out in a couple months that I've really worked on, specifically for the postmenopausal for postmenopausal patient, but that's good for everyone, but specifically designed to be very nurturing and slick. But anyway, I'll tell you about that in a second. The ones that I have my clients use in the meantime is first, I definitely recommend using, you can do something simple like coconut oil. You can do a DIY lubricant with aloe vera, um, a organic aloe vera with in a liquid formula, and add in equal portion of fractionated MCT oil and a drop or two of your favorite essential oil. Shake that up and keep that bedside. It does separate, but yes, lubes have a good clean profile. Good, I think it's called Good News. I'll say it's Good News. Good News lubricant, or another really good clean lubricant. The one I've created has aloe vera, hyaluronan, and some ginseng, as well as another ingredient to support, again, supporting the mucosa, supporting glycogen, and supporting the microvasculature and libido in it. So I'm excited to be releasing that in a glass bottle, so that it's no microplastics too. So
Erin asked if there's any contraindications using DHEA vaginally in a hormone positive breast cancer patient.
it depends. It depends. Well, I've published, and on my website, which is dranna.com, look at my breast cancer and DHEA article, and I present the research around that. So I have definitely have patients with history of breast cancer that I support their hormones with, and certainly vaginal health. And it seemed, we have very good safety profiles on DHEA vaginally. So I, with patient consent, compliance, and a good patient, you got to addressing the underlying issues to the breast cancer to begin with. I typically do, and I have oncologists that recommend my Julva product, which has DHEA in it, without hesitation for their clients who are struggling with vaginal atrophy and their course of breast cancer and tamoxifen treatment. And we have good research around that. But look at, just search at dranna.com for my breast cancer and DHEA article. that has a lot of information on that. And I would say too, in these cases, when I look at breast cancer, what helps? So the ketogene diet, intermittent fasting, alkaline urine pH, creating insulin sensitivity, driving that hemoglobin A1C down below 5.3, getting your vitamin D 25 hydroxy level up past 60, 70, depending on the individual, but getting that vitamin D level up is critically, I mean, those things are, even more important in addressing breast cancer, which often, again, I see patients from, all demographics, and very rarely do they come in having had a breast cancer diagnosis and any of those things are addressed. So you guys, I'm encouraging you to empower you to address those things. Okay. Ruth had said, who makes oxytocin vaginal gel? Oxytocin vaginal gel is a prescription. So compounding pharmacy would make an oxytocin gel or rapid release suppositories or troches that can be made. You can put them into a knowledgeable compounding pharmacist knows that oxytocin cannot be heated. So the way they're making those suppositories or troches are very, very specific. So you want to check on that too. But typically it's easy to do a suppository versus a messy gel. Um, and Annette said, having issues with patients taking DHEA and losing a lot of hair. Any suggestions? I can't take oral DHEA. I mean, I don't. I get acne, I get hair loss. I mean, I forget it. Like I've been there. I've had hair loss back to here in the past from PTSD. But anyway, another story for another time. So I totally get this. I just can't metabolize it. I convert very quickly. So in this case, when they're doing, I don't use oral DHEA very much at all. But if I do prescribe oral DHEA for a woman, it's typically starting at 7.5 milligrams to 15 milligrams. I've had people come in on 50 milligrams. And then in a phospholipid base, so it's slow dissolve. And and that helps with instead of that rapid push of DHEA. The other thing is topical bypasses the hepatic metabolism, and so you can use topical DHEA instead. So that's one of the reasons I started creating DHEA in a topical cream for myself way back when now, decades ago. So, all right.
We have a
Jana
question
said,
on interstitial cystitis and
ah,
lactobacillus.
so interstitial cystitis, again, is one of those hard things to treat and address. So interstitial cystitis, as I trained, we did, bladder distensions with, hydrodistensions of the bladder, Kenalog infusions. And now we'll use ozone therapy, but I address the diet, the nutritional profile, food sensitivities, urinary alkaline pH, and sometimes, again, we'll do vaginal, bladder ozone insufflation if needed. And I haven't had to do bladder distensions or um, intravesicular Kenalog in a long time. So this is the way I've gotten around it. So the dietary food changes specific to IC and the addressing food sensitivities, improving the uh, health of the bladder mucosa. So other things you can use for improving the vaginal mucosa, like D-mannose. So we'll use D-mannose and a gut healing protocol. So using your megaspore biotic, using what's that? I like also the GI intercom because that helps with the nervous systems, helps with the mucosal lining, and helps with a lot of the anxiety, et cetera, around IC. So it's GI intercom, Maureen, is that right?
That's not a microbiome lab product.
Oh, sorry. I'm thinking it's something like that. I thought it was yours. Is it not yours? In a powder stick pack?
No, that one's not ours.
Okay. Good to know. But yeah, there's that one that I use too.
People are saying it might be related to a biocidin product, perhaps.
Oh, maybe it's the biocidin. You guys are on our same shelf in the clinic. Okay.
Um, well, thank you so much, Dr. Cabeca. We appreciate your time and all of your interest. For those of you that are watching the clock, we're right at our time. If there's any last points that you'd like to discuss while you're available.
Yeah, well, one thing I would just invite you guys to dranna.com. Can I give a link to my menopause certification program? Is that okay? Can I give you guys a link to that?
Yeah, you can share that in the chat.
Okay, okay, let me see. Amira, can you help me share that link? That my slides here. Let me I'll flip this. Hold on. So I go deep, and this is a 16-week course, a menopause certification program to address a lot of these issues in depth in this program that I'm launching this year. It's based off my Magic Menopause program, addressing understanding hormones, lab tests, the keto alkaline approach, or the key factors of alkalinity, as well as vaginal health, bladder health, and the stress cortisol oxytocin connection. I go deep into testing, including Dutch testing and hormone testing in this program, and we're certifying practitioners. We'll be announcing this. There's currently a wait list, so we'll be planning to start this within, by the end of this first quarter. So I hope that helps everyone. And you guys have more questions, let me know. I am, excited to be here. I know I didn't get to all your questions. Um, but yeah, I hate that I didn't get to all your questions and comments, but I thank you guys for being here. If this was helpful to you, let me know. I know we only have this limited amount of time, but I would love to know if this was helpful to you, and then let Maureen know if you guys want me to come back and talk about something else. I am speaking in Philadelphia this weekend, and I'll be speaking again in February. I mean, in this weekend in Philadelphia. So I look forward to it. Thank you guys for being here. I appreciate you and good luck.